Hello everyone, my name is Muhammed Ershad. I'm one of the emergency medicine residents at Detroit Receiving Hospital, and I'm here to talk to you guys about this poster which describes a quality improvement project that we did on prescribing inhaled corticosteroids to patients with acute asthma exacerbation discharged from the emergency department. Patients presenting with asthma exacerbation are recommended to be started on inhaled corticosteroids when being discharged from the ED. There is at least moderate level of evidence to show that inhaled corticosteroids can reduce hospital admissions due to moderate to severe asthma exacerbation. Most patients who have suffered an exacerbation of asthma that is severe enough to require an ED visit should receive an inhaled glucocorticoid as part of his or her discharge medication plan. A recent assessment performed by the Detroit Young Adult Asthma Project at Wayne State University showed that only 8% of the patients discharged from the ED across two DMC sites, Detroit Receiving Hospital and Sinai Grade Hospital, with a diagnosis of asthma received a prescription of inhaled corticosteroids. Now, this could possibly lead to a notable increase in the number of bounce backs of asthmatic patients in the ED and hence prove detrimental to the long-term control of asthma in such patients. The primary objective of our study was to increase the frequency of prescription of inhaled corticosteroids to patients discharged from the ED with a diagnosis of asthma. The target audience for this project included ED leadership, attendings, residents, mid-level practitioners, nurses, and social workers. Our primary objective was achievement of at least 50% prescription rates for inhaled corticosteroids. This number was identified after estimating the scale of the problem by performing a retrospective chart review of consecutive patients in the months of November and December 2020. The next step included identifying possible challenges, obstacles, and shortcomings that is specific to our department, that is preventing physicians from prescribing inhaled corticosteroids. These obstacles were plotted on a fishtail diagram. And to identify what these obstacles were, we did a pre-intervention Google survey. The target audience was EM attendings and EM residents across all levels of training at Detroit Receiving Hospital. Those pie charts that you see on the top of the poster summarize the results of the survey. As you can see, we got around 26 responses, and almost a quarter of them were from EM attendings, and the rest were from all levels of training at the Detroit Receiving Hospital Emergency Residency Program. They were asked about the fact that is emergency department a suitable place for prescribing inhaled corticosteroids, and almost 85% felt it is a suitable place. They were also asked about how frequently they do prescribe inhaled corticosteroids, and almost 46% they said they do frequently prescribe it, but almost 20% said they almost never prescribe it, and around 23% prescribed it only if the patient actually requested for a script. They were also asked about what barriers exist in the emergency department when it comes to prescribing inhaled corticosteroids, and 42% felt they were inexperienced with prescribing inhaled corticosteroids that made them uncomfortable to prescribe them. Around 35% said they were not sure if the patient's health insurance covered the cost for these scripts. Around 11% felt they did not know how much to prescribe, what to prescribe, or in short, they did not have a clear-cut guideline on how they could start prescribing them in the ED. They were also asked what could be done to increase the rates at which ED physicians are currently prescribing them, and almost 39% felt that having a favorite folder set up on the EMR could be an easy way of increasing the prescription rates. Around 27% felt that establishing official ED guidelines and communicating this through posters all across the department would be another way. Around 23% felt that including this topic in discussions during didactic lectures and ED staff meetings could be another way at spreading awareness about this. So based on the survey, we listed down the possible obstacles. We then came up with possible interventions, And the first and the foremost intervention that we did was making sure we talk about this, communicate about this during our residency didactic lectures, during ED staff meetings, which usually attended by most attendings. And we came up with a prescription guideline in the form of a flowchart, as you can see on the right side of the poster, that describes in simple stepwise step pattern on how to prescribe and what to prescribe and how much to prescribe to the patients before discharging them. A copy of this flowchart was placed in all parts of the department. We also created a folder, a favorite folder on Sonar, which made it easy for physicians to just click and prescribe inhaled corticosteroids along with the usual oral steroids and albuterol before discharging them. We also educated the residents about how to open up charts of patients and find out what insurance they are under, and to find out if the scripts would actually be covered by the insurance. We also made use of Good RX application in order to find out where patients could go and find the medications for the cheapest rates. Once we were done with all these interventions, we did another retrospective chart review in the months of November and December of 2021. And as you can see, we have the results summarized in the form of bar charts in the bottom of the poster. The gray bars represent the numbers for 2020, and the yellow bars for the numbers for 2021. As you can see, for inhaled corticosteroids, the numbers went up from 26% to 60%, and for oral steroids and albuterol, for which we were already doing pretty well, we were able to show improvements in that as well. So in conclusion, through physician education, establishing prescription shortcuts on EMR, generating protocols and flowcharts for prescribing inhaled corticosteroids, and making use of applications like Good RX in order to help patients with finding the right appropriate junction where they can get the medications filled for the cheapest rates, we were able to improve the prescription frequencies for inhaled corticosteroids in the ED. And with that, I would like to conclude my talk. Thank you.